Hi, and welcome to our lecture on leading, managing, and following from your Yoder and Wise Chapter 1 in the text. You can see our objectives as per the syllabus. We will open with a case study that is from the first section in your textbook chapter, and this was written by a master's prepared nurse based on her experience in a new management role. So, in accepting a formal leadership position as an emergency department director, she was the fourth formal director in 3 years in a union 32-bed inner city ED. So, there was a strong attitude of management versus staff, as well as a very informal leadership structure where power and authority rested with the most senior staff, and those staff had over 10 years of service, so definitely experienced and probably very good at what they did. But she noticed that the formal policies and procedures didn't reflect what actually was being practiced. The patient flow process depended completely on who was in charge that day. So, depending on which nurse was in charge, the daily flow was varying based on chronology or chart review or acuity as far as when they were triaged and assigned, and no one was questioning this. The staff had to adapt each day. Providers didn't push this either, they just worked with whatever the flow of the nurse who was on. When she first started on her first day, one of the senior members of the staff informed this new director, "We were here before you and we'll be here long after you're gone." Basically implying that the formal authority was not something they respected or accepted. So the question to reflect on throughout is, what do you think you would do if you were this nurse? This can definitely happen, and I've had it happen in my career, particularly if you come in and are younger or less experienced, even if you have some really strong leadership skills or a really great background educationally. So we do have to definitely come in with our eyes wide open and not maybe make huge changes immediately, as well as we do need to establish our authority and make clear that we are the formal leader and establish some of that as well. So consider that as we go on. So leadership is defined as using power to interact constructively to resolve problems. And basically, the leader is assessing the context surrounding the situation and adapting and creating strategies that are going to get us to a good outcome. Management is just the act of any individual that guides others through a series of routines, procedures, or practice guidelines. So the focus here is less on the critical thinking and adapting and more on the directing people to complete those processes that are known and expected. But managing can also refer to more internal work and energies, so guiding ourselves through a process or even just managing someone's pain. So we need to understand what's causing the pain, know what our options are for intervening, and then apply them from simple to complex depending on the need. Followership is something we don't talk about a lot, but definitely important to any leader and any team. They have to provide a complementary set of healthy and assertive actions that support the leader or the manager, and there's a dynamic interplay between all of these individuals. So that helps to define the culture for the organization and the team. And so we need followers that support and also practice assertive behaviors, so they do question when something is not correct, but they do it in an appropriate manner. Emotional intelligence is the possession of social skills, interpersonal competence, psychological maturity, and emotional awareness that is devoted to helping people work well together. All of us can probably think of someone who is lacking that emotional intelligence, and we'll get into a few examples as we get into the 5 domains, but this is what helps others see us in a positive light. You can have 2 people that are presenting the exact same idea to 2 different groups, but the one with stronger skills in emotional intelligence is going to be perceived more positively than the other, even with the same outcome. Understanding how you're perceived buys us social capital, which isn't really covered in our chapter, but social capital provides grace. If we have the social capital in that we are liked and respected and trusted, we can make mistakes and people will understand that, and they don't attribute the mistake to our overall character, but rather a mistake. Whereas someone who is lacking that social capital doesn't typically get that level of grace, and someone tends to assume that a mistake is just inherent of their character. So the 5 domains are having self-awareness, and that means you can identify the emotions you're feeling and how they're altering your perceptions. So very important when we're having interactions that can become heated. So then we manage our emotions, and that means that we try to avoid anger, fear, and passive aggressiveness, or if we are experiencing those, we don't act on them immediately. We wait to cool down a bit. Motivating self suggests that we'd be inwardly rather than externally driven. And so that looks a little bit at the intrinsic and extrinsic motivating factors. Nobody's all one or the other, but that is part of emotional intelligence, is just having our own drivers. Being empathetic means that we value differences in viewpoints, don't necessarily side with one group or another, but also that we understand where someone is coming from even if we don't agree with them. And then handling relationships, so meaning that you're socially appropriate. Sometimes this is just a lack of maturity, or again, that lack of awareness that maybe something you think is completely okay is not so socially acceptable. Part of your assignment will be to do an emotional intelligence quiz and then reflect on your results. So that's kind of interesting and entertaining, and you'll do a little self-assessment after you complete that. Box 1 looks at some of the attributes applied to both leaders and managers, and one of the big ones that always jumps out at me in this list is dealing with people skillfully, coaching, communicating, and counseling, as well as identifying the needs of others. So we have to be able to know what our employees need and provide them with that if we want them to be able to perform for us. There are a couple theoretical bases to our leadership theories. We either have, or to leading, managing, following, we either have leadership theories or motivation theories. Bly and Koziak are those who divided them into the 2 categories. Theory can direct and sharpen the ability to predict or guide clinical organization problem solving and outcomes, and so that's why we cover these. So the trait theories fit into leadership theories, and this was kind of an early 1900s theory where basically it was accepted that leaders have certain sets of traits that are required so that they can be a good leader. Some of the theorists believed that those traits were innate and not learnable, while others believed they could be developed. And so to apply this to practice, even though it's kind of an old and perhaps outdated model, is just having a self-awareness of those traits that are useful in self-development, as well as seeking employment that matches our traits, so our drive, our motivation, and our integrity. It's never a good fit if we are working someplace where those conflict with our innate traits. Style theories also are part of leadership theories, and so these are sometimes referred to as group or exchange theories. They were developed because of some of the limitations of trait theories, and these look at what leaders do in relational terms. So saying that leaders need to get feedback from their followers, superiors, and peers, and that those who are employee-centered tend to be the most effective as far as work environments and productivity. Situational contingency theories look at the relationship between the leader's task and his or her skills, and then the favorableness of the work situation. For example, if you're in an unfavorable work situation to start with, say something is going on in the organization or in the culture, it's going to be more difficult to motivate employees no matter what your leadership skills are. So the contingent variables they look at are the personal characteristics of followers and then the environmental demands. So in applying that to practice, they just say that the most important implications are that we look at the challenge of a situation and that we can adapt to it to best meet it. The same style is not going to necessarily fit each situation or each person involved. When we look at the transformational theories in the leadership theories, this is a more recent development in the late last century and early this century, and just looks at a process where the leader is attending to the needs and motives of the followers so well that the interaction is very high level, and the leader is essentially an inspirational role model. This is kind of a little bit pie in the sky the way it's written, but transformational leadership is a valid theory and has been really a hot topic. It's just not always fully described. It kind of makes it sound like somebody is just inherently charismatic and can do this, but that's not necessarily the case. Just kind of described that way. So when we apply it to practice, we look at transformed organizations being more responsive to customer needs. They're morally and ethically intact, and they promote employee development and encourage self-management. So nurse leaders who have these transformational characteristics or can develop and grow them are going to be comfortable experimenting with redesigning systems and trying to improve and create different processes to better the flow and better the experience. When we get into the motivational theories, we look at the hierarchy of needs based on Maslow's theory. And so we have obviously our basic human needs, and those have to be met. And we have to meet all of those before we can reach the higher level needs, such as self-actualization. So those lower level needs are going to drive the behavior before the higher level needs will even be addressed. So when we apply this to staff, we have to be aware that the need for safety and security are going to override the opportunity to be creative and inventive. So when we're promoting job change or encouraging someone to seek an opportunity, if they don't feel that it's going to be stable and secure for them, or perhaps there's some financial instability involved, a lot of times those factors might win out, even though the creativity aspect and the growth aspect are intriguing to them, because those lower level needs have to be met as well. The two-factor theory is another one of the motivational theories, and this looks at hygiene factors and motivator factors. So the hygiene factors are the working conditions, the salary, the security. Those have to be met. They don't create job satisfaction, they just have to be in place so that work can be accomplished. Motivator factors are going to help develop job satisfaction, and these are things such as achievement, recognition, performing work that provides satisfaction, and then just promoting job enrichment by creating job satisfaction. One thing to note in the application is that transformational leaders use the motivator factors very liberally to help inspire work performance. The expectancy theory looks at the individual's perceived needs and how that influences their behavior. So if a person sees a positive relationship between effort and performance, they're going to continue to perform that at that level. Expectancy is that perceived probability of satisfying a particular need. So if your need is for recognition, or if your need is for higher income, or your need is to be able to attain some other sort of reward, if you're getting that kind of feedback and the kind of reward that you're seeking, you're more likely to continue that. So nurses in leadership roles have to be able to provide specific feedback so that staff know for sure that what they're doing is on the right track or being rewarded, and also they have to recognize how that employee is motivated so that they can help to drive that. Organizational behavior modification was based on operant conditioning, and so this is where we want to use positive reinforcement to motivate people to repeat constructive behaviors, negative reinforcement for anything that demotivates staff, and then extinction or the purposeful ignoring of negative behaviors or even just non-constructive behaviors so that we get the desired outcome. Complexity theory is a theory on its own, and it's addressed because healthcare organizations are considering this as a new way of viewing both clinical and organizational issues that haven't responded to the more traditional top-down hierarchical approaches, and basically promotes the idea that the world is full of systems that interact and adapt through relationships, and that nurses have to be flexible and dynamic to be in tune with the ever-changing systems of healthcare and public policy and human relationships. So the principles of the complexity theory are that networks are any related group with common involvement in an area of focus or concern, so not a formal thing. That they encourage non-hierarchical interaction among workers, so bottom-up or shared governance models. Leadership tag, and the term tag is basically an attribute, so it references the philosophic and values characteristics that give an organization its personality or culture. The focus on emergent looks at the concept of how individuals in positions of responsibility engage with and discover those networks that are best suited to respond to problems in creative ways. So looking at those networks that are developed, even if they're informal, and determining which of those is going to work the best to get the job done in a certain situation. And that's tied to using constructive energy and unleashing that rather than trying to constrain energy and restrict. Then, in thinking systematically, obviously it's looking at the big picture and long-term objectives, and then also looking at how data is complex and interdependent and how we have measurable and non-measurable as well. Gardner's tasks of leadership are a way of kind of defining leadership at the bedside and then moving into a little more global view. So we have envisioning goals, and that could be looking at outcomes for a specific patient. Affirming values, so working with the patient to help articulate their personal values in relation to health. Motivating, where we would relate and inspire the patient to achieve their vision. Managing, so assisting the patient with planning and goal setting, and then ensuring that our organizational systems are working on the patient's behalf, working with transportation, working with the scheduling so that we can make sure that something's going to work for them to meet these goals. And then achieving workable unity. So again, making sure the system is going to work for the patient and family so they can achieve optimal functioning and have the benefits of enhanced health. So as we move on, these get to be a bit more global. So in developing trust, it's keeping promises to patients and families and being honest in role performance, so not over-promising things that we can't deliver. And this could also be true for working with employees and supervisors. We want to ensure that we're keeping our promises and meeting our obligations to them as well. Explaining would be teaching and interpreting information to help promote well-being. And then serving as a symbol is representing the profession and the values of the organization to patients and families and the community at large. And then representing the group, so representing nursing or the unit in task forces or total quality initiatives or shared governance and other groups. And then renewing, so providing self-care to enhance the ability to care for staff, patients, families, and the organization. So we have to renew ourselves and support others to renew themselves. BELI has 9 tasks of management as well as 9 tasks of followership. Not something that you have to necessarily memorize by any means, but just knowing that there are tasks for both and that followers have a job to do just as much as leaders have a job to do. So in conclusion, managing, leading, and following are all very complex areas and tasks that require active performance of those roles to be effective. Each one is important in creating the whole of nursing care for our patients. This concludes the lecture.